You stayed up all night, grabbed an energy drink, and now you are thinking about hitting the gym. That combination may place more strain on your body than the missed sleep alone, especially when exhaustion is already affecting your balance and judgment. One bad night usually causes fatigue, poor focus, irritability, and slower reactions, not sudden death. But severe or repeated sleep loss can affect blood pressure, heart rate, judgment, coordination, and safety. Add stimulants, intense exercise, alcohol, dehydration, or prolonged sitting, and the situation may become more concerning. These 6 situations are practical warnings, not diagnostic criteria, and they cannot predict who will have an emergency. First, getting only 3 or 4 hours of sleep for several consecutive nights is not ordinary tiredness. Severe short-term sleep loss can impair attention, decision-making, coordination, and reaction time. It may also temporarily raise heart rate, blood pressure, and the body's stress response. For many otherwise healthy people, the most immediate danger is an accident rather than a sudden heart event. If you are fighting to keep your eyes open, do not drive, work at height, or operate machinery. Coffee may make you feel awake, but it does not fully restore judgment, coordination, or reaction speed. Second, one short night is different from regularly sleeping less than your body needs. Most adults should aim for at least 7 hours of sleep each night, with a reasonably consistent schedule. Regular short sleep is associated with high blood pressure, heart disease, diabetes, obesity, and depression. Sleep is not the only factor. Stress, diet, illness, medication, and work schedules can also contribute to the same health problems and complicate the relationship. Sleeping late on weekends may reduce fatigue, but it cannot reliably erase an entire week of insufficient sleep. Third, exercise is normally beneficial, but an intense workout after severe sleep loss may be unwise. Do not use a hard workout to test whether you can push through exhaustion or concerning symptoms. If you feel dizzy, unusually weak, unsteady, short of breath, or have chest discomfort, stop and rest. Chest pain and breathing difficulty are not normal signs that you simply need to warm up, and continuing the workout could delay appropriate medical care. Fourth, caffeine can temporarily improve alertness, but it cannot replace the restorative functions of sleep. Large amounts of coffee, caffeine pills, or energy drinks may worsen palpitations, shaking, anxiety, and blood pressure. Using several stimulant products together is more concerning, especially for people with heart or blood pressure problems. Alcohol may make you sleepy initially, but it often fragments sleep and reduces sleep quality later. Mixing alcohol with energy drinks can mask impairment and make it harder to judge how affected you are. Heavy, fatty, or spicy late-night meals may worsen reflux and further disturb the little sleep you get. Fifth, working, gaming, studying, or traveling overnight may keep you almost completely still for hours. For most healthy people, one long sitting session does not mean a dangerous blood clot is likely. Risk is higher after a previous clot, recent surgery, cancer, pregnancy, limited mobility, or certain estrogen treatments. Stand up and move periodically when possible, especially during overnight work or long-distance travel. Unexplained pain and swelling in one leg should be assessed, particularly when risk factors are present. Sudden breathlessness, sharp chest pain, coughing blood, or fainting with leg symptoms requires emergency care. Sixth, a normal shower after a late night is not known to cause a stroke or brain hemorrhage. But very hot baths and saunas may lower blood pressure and worsen dizziness or dehydration. If you already feel faint, confused, weak, or unsteady, avoid extreme heat and do not stay alone. More importantly, persistent or worsening dizziness and weakness should not automatically be blamed on tiredness. Now for the most important point, serious symptoms should never be dismissed as simply needing more sleep, even when they appear after an all-nighter. Call emergency services for chest pressure, squeezing, fullness, or pain that lasts or repeatedly returns. Pain spreading to the arm, back, neck, jaw, or stomach can also signal a heart attack. Shortness of breath, cold sweat, nausea, fainting, or sudden severe weakness also require urgent attention. A rapid or irregular heartbeat becomes especially concerning when accompanied by chest pain, fainting, or breathing difficulty. Sudden facial drooping, one-sided weakness, or slurred speech may be signs of a stroke. A sudden extreme headache with confusion, vomiting, weakness, or vision changes also needs emergency evaluation. Do not drive yourself if you may be having a heart attack or stroke. Call emergency services. Extra caution is appropriate with heart disease, previous stroke, serious arrhythmias, uncontrolled hypertension, diabetes, or prior blood clots. Loud snoring, gasping, witnessed breathing pauses, morning headaches, or persistent exhaustion may suggest sleep apnea. Persistent insomnia, anxiety, pain, medication effects, and shift work may need professional help, not another coffee. After a bad night, avoid driving, excessive caffeine, alcohol, and hard exercise when you feel dizzy or unwell. Return to a consistent schedule, seek help if short sleep persists, and never ignore emergency symptoms. This is general education, not personal medical advice.